So one of the things that will happen if the Republicans have their way and repeal health care is health insurance companies will be allowed to raise premiums at any level as quickly or as much as they want without being held to this medical loss ratio. That may not be the worst thing, though. Any person in America who's been raised in a family where someone in the family suffers from what's known as a pre-existing condition knows that you always live in fear that you won't have health insurance, and fear that if you have to go out and buy it on the open public market, you'll never be able to afford it. This law that Senator McConnell and the Republicans want to repeal today, this law says that no health insurance company in America can discriminate against anyone under the age of 18 who has a pre-existing condition. Now that's something that any parent would appreciate. You never know if that beautiful son or daughter of yours is going to have problems with asthma, diabetes, cancer, mental illness, and you certainly want that child, that love of your life, to have health insurance coverage. Senator McConnell and the Republicans want to repeal the protection for families that have children with pre-existing condition. That's a fact. It isn't as though they're offering exclusions and saying, no, we'll keep that. They've eliminated the entire law with this 3-page amendment. They've eliminated these protections. And how about the protection for those who get diagnosed with a serious illness and find their health insurance companies cutting them off completely, putting a cap on the amount of money they'll spend to provide for medical services and treatment, saying at some point they're going to eliminate their policies altogether because they failed to make a disclosure on an application form? It happens too often. In my state of Illinois, sadly, we lead the nation in what's known as rescissions. Health care insurance companies that cancel coverage when people get seriously ill. How would you like to be in that predicament? How would you like to be facing a serious illness that keeps you awake at night, tossing and turning about whether you're going to live or die, and then fight a health insurance company during the daylight hours in the hopes that they'll cover the prescriptions and treatment you need to stay alive? That is the reality. A reality that is addressed by the Health Care Act, a reality that would be repealed by Senator McConnell and the Republicans' efforts today. Those are the real results of what they want to do. It isn't just about who wins the political debate and has the largest cheering section when it's over. It's about real-life changes. How about senior citizens, those under Medicare? Well, many of them struggle to pay for prescription drugs, even with the Medicare prescription drug plan. There's a gap in coverage called the donut hole. We start to close that gap and say to seniors, if you have expensive prescription drugs, we're going to make sure ultimately that they are covered completely from the first of the year to the end of the year. Now there's a gap in coverage. The Republicans and Senator McConnell want to repeal that provision of the Health Care Act, which provides for seniors not only more coverage for their prescription drugs, but also an opportunity for an annual physical and the kind of preventive care that they need to stay healthy and strong and independent in their homes for a longer period of time. That is what Senator McConnell and the Republican senators want to do with the repeal of this law.